You're watching Parker Success Academy with Dr. William E. Morgan.
Hello, I'm Dr. William E. Morgan, and this is Parker Success Academy. Today I have two very special guests, Kaira Tanwar and Dr. Alayna Pagnani-Gendron. Did I say that correctly?
Yes, thank you for having us.
Anyway, you both represent the Texas Chiropractic Association. And of course, we're in this great state of Texas, and it's just so great to have you here. Could you tell us a little bit about yourself?
Sure.
And how you got to where you're at now?
I'm Dr. Alayna Pagnani-Gendron. I'm located in Houston, Texas, and I've been in practice for about 10 years. My specialty is in pregnancy and pediatrics, and I've been involved with TCA for about 7 years. I was membership chair and then moved up to an exec position. I'm the current TCA president.
Fantastic. Kaira.
Kaira Tanwar. I am the executive director as of June 1, so I'm very new to the Texas Chiropractic Association, but not new to association world itself. I was with actually the CPA Society before that, so I have a good experience working with associations, but I'm very lucky to work with the Texas Chiropractic Association. Very fortunate here to work with Dr. Pagnani-Gendron as well. It's been such a pleasure to working with the second female president of the Texas Chiropractic Association, and I'm very, very happy that she's here to help lead the way. So thank you for having us.
And it's great to have you here. And you've been in leadership for a while now, and you've been involved with Texas Chiropractic Association, something that I really strongly support. We like to have our students support that, and our alumni as well. And I dove right into it. I got here about 5 years ago and dove right into the battle with the Texas Chiropractic Association. Made a lot of friends, and we've had some big battles and some victories and some challenges. So would you like to talk a little bit about some of the victories we've had?
Yeah, we've had two major victories. One was diagnosis. We had a big lawsuit that potentially we're going to lose our right to diagnose patients, which would have been huge and very detrimental to our practices. And the second one was nerve-neuro issue. And so that was potentially we would not be able to treat anything like sciatica or headaches. And we won with the Supreme Court on all levels that we could treat anything with nerve-related musculoskeletal. And so that was a huge win, and one of the reasons why we're all able to practice how we can in Texas.
We partnered with you. Parker's been a big part of those battles, and it was we were all set for a legislative battle of all times for us. And then the Supreme Court judge basically, what do they call it? They basically sided in our favor. So that battle didn't have to be fought.
Yeah, our whole legislative session this past year was focused on nerve. That was our bill. That's the only thing TCA, or the major thing TCA was going to focus on. And we literally had our legislative week coming up and found out about our court case that we won and had to pivot very quickly on what we were going to try to do this year. So it's a good thing, though.
Yes, I'll take it.
Yeah.
A victory is a victory.
Yes.
And it was just serendipitous that came together right before the session started, because we basically had singular focus on what we were after. We had to win. That was a do or die issue as far as in our conversations. So, Kaira, since you've arrived 2 months ago, what have you learned about chiropractic and the battles that we have, and the uniqueness of the profession?
Absolutely. I will have to say I had actually never seen a chiropractor before joining the Texas I had never seen a chiropractor before.
I heard you.
But it was such an eye-opening, it was an eye-opening experience. It was probably one of the most thorough exams I had ever had, and finding out things that I probably should have found out a long time ago and had been working on. So I am behind on my adjustment, so I apologize for not seeing my chiropractor since a couple weeks. But I do need to go, and I have really found the benefit of it and has helped me, and there's more things that I need to do. So going past the chiropractic massage, I'm like, I definitely need one of those too, because it was fantastic. But it's just been an eye-opening. The chiropractors are all very friendly and open, and they really do care about their patient. And was like the best thing for me. So
it really is, as we talk about in our conversations, is what we're doing is to help people and to remove the barrier to good health. The things that we do are where true health comes from, not from a pill bottle, but to remove barriers to good health and to fulfill their health and live their life out in such a way that they can have a maximized sense of well-being and health. So for us as chiropractors, we look at it's self-evident that removing the barriers to good health is how you should treat all healthcare. That you should promote health and not treat disease.
Yep.
I mean, easiest thing in the world is to tell when somebody's sick. The hardest thing in the world is to promote health.
Yep.
So where do you see the TCA going? You're part of the inner circle, the inner sanctums of strategic planning. Where are we going as an organization over the next year or two?
So we have a 2-year strategic plan, which we are excited to sort of introduce and get going. It's going to focus on 3 goals. And first one is getting more patients in chiropractic offices by educating them. Second is getting higher reimbursement from insurance companies, so working with insurance companies for better payment. And then third is building relationships with our legislators so that hopefully next legislative session, all the bills that we want to pass will go through.
And we want to support you every way we can. And we've had conversations. Some of the other things we've worked on is trying to get this Medicare bill through Congress, a national bill, which will benefit a lot of chiropractors and a lot of patients that are basically, it will basically give equity to chiropractors for reimbursement for what they already are doing in their offices. So we want to promote chiropractic and make sure that chiropractors are reimbursed and our patients have easy access to care.
I think we're all wanting the same thing.
Yes.
You know?
It's when I came here though to see there's another organization that frequently haunts the halls of the Capitol. I remember the first year I was here, I was going to testify, and I was waiting there for 13 hours, and it was the TMA, Texas Medical Association, versus the physical therapists, versus the vets, versus the acupuncturists, versus nurse practitioners, versus, it's like, is there anybody that they're not trying to suppress their scope of practice? And frankly, I felt like I'd gone back in time 30 or 40 years because I just moved to Texas, and I didn't realize these type of battles were still being fought. And it's these victories that we must win, but we need everybody to be part of the lift.
We need everyone.
Absolutely.
Yeah. It's important to have every single chiropractor involved, whether you're a student in practice or retired. But I was like, if we all stick together, it's for the greater good of our patients.
Yeah, and if you're having a global campaign to increase, chiropractic access, why wouldn't all of us join the TCA to support that and donate? So that's one of those things that's it's self-evident, but there's always people who would rather not give. They're not joiners. And I'd just like to encourage you, if you're in Texas and you're benefiting from being able to diagnose or to treat neurological conditions, including subluxation, you should be a part of the Texas Chiropractic Association. So, and you've got some big events coming up this next year. This year we had COVID, so the Texpo was virtual, and it was live. I'm sorry.
It was the first live event.
Yeah, first live event. That's right.
So that went really well. It was my first event, 10 days on the job, so it was eye-opening. Fortunately, we had some other people that had been there for a while to help out, but it was eye-opening. I got to really know a lot of the members there. It was fantastic to know a lot of the people at one time, and just to see how the organization runs and the good that comes out of it. So that's what we are. We're here as an advocate, as a friend, as those types to help with the profession.
And it always astounds me when people say, oh, those guys, when they do this, and it's an organization. You join it and you become, it's us. It's not us, them, it's us.
Exactly.
It's our new slogan is We Are TCA.
We are TCA.
We are TCA.
Yeah, that's brilliant because if you're a chiropractor, if you want to make a difference, if you want to help the direction, join and be part of the solution. Because there's plenty of people out there who like to complain and not lift a finger to help. And we want to just get the people who do want to help, give them direction. So the strategic plan is you're planning this out.
Yep.
Any things that we should know about as chiropractors that we could do to help you?
Yeah, we're going to have a couple of call to action things. We're looking for some videos, and we're also looking for maybe research articles that we can start posting. We want to really focus on a website for the general public to inform them about chiropractic, and then we're going to have a Find a Doc button on that website. And so we're going to need content for that. We're also, if you have any connections to anyone in the legislative process, please let the TCA know so that we can reach out to them directly. And then if you have any contacts with insurance carriers, we also would like that information.
Well, and what you're looking for is there's legislators who go to chiropractors. They love chiropractic, but they might not know our battle.
Yeah.
If you have that relationship with the legislator, if you could bring that forward, if you'd be willing to basically carry the water for the TCA and move things forward so that we can expand our scope of practice and basically our livelihood.
Yep.
Absolutely. It's all about who you know sometimes.
I found that more so in Texas than any place else I've been. And we were talking earlier. I used to work in taking care of Congress, and it's astounding. I think people will be surprised how many members of Congress see a chiropractor.
Yeah.
Far above the national average. Far above the national average. But sometimes they just don't know that they need to help us out to keep that access open. So where would you like to see this organization go, let's say, in the next 5 to 10 years?
Do you want to answer that one first?
No.
I want the new person to answer.
Absolutely. Well, first and foremost, we definitely focus on our membership, and we, every new chiropractor that gets licensed in the state of Texas, we would love to have a member. It is not a requirement, of course, but of course we are here for you whether you're a member or not. We are fighting for that license, and we are the advocate for the chiropractic profession. And as far as I know, we are the only association that has that kind of merit in the state of Texas. So, but then of course we work with the ACA, and we try to do we're working on the Medicare bill and getting the words out to our members, who hopefully get the member out to their patients, because it's not just our members who should be involved, but their patients should be involved as well. So I went ahead and signed that petition to the ACA, and I hope everyone else did as well.
If you magnify the number of patients that we see, it's millions, it's tens of millions of people that we can bring to our army to fight for us, but they don't know if we don't tell them.
Absolutely, yeah.
So Alayna, where do you see the future of TCA?
I'm going to piggyback off Kaira. My goal this year, which I know is a really hard attainable goal, but I want to see every single chiropractor in Texas be a member of the TCA. And I really want to see us get more patients access to care. I want people to know that we're here. I want them to know what we do and how we can help them, and I want them to come to our offices.
I love those goals, and I love increasing access to care. The Medicare bill, of course, will help virtually as I draw closer to that age, and I realize a lot of people don't want to take Medicare because it doesn't pay enough, or it's a hassle to bill. But so I'm like, so how do I get care when I get to that age, or how do all the people in Medicare age get that care? So I'm convinced that bill that the ACA is promoting, just like the Texas Chiropractic Association only focused on one bill, the one that they really needed to pass, the neurology bill. The ACA and I'm in their legislative committee focusing on one bill. And I'm usually the person who's trying to expand chiropractic in the military. I'd set that aside. We want just to have that Medicare bill.
This is going to open doors.
Oh my goodness.
So many doors.
It will open a lot of doors.
I will say the TCA, our governmental affairs coordinator, voted on 100% supporting the ACA, and he has using TCA resources to get whatever we can get accomplished for the ACA. So we're all in.
I think recently we've picked up 3 other co-sponsors. We have over 80 co-sponsors for that bill. It's pretty astounding.
And 3 because of you, Dr. Morgan. So thank you.
So,
thank you very much.
So it's going well, and we got a lot of work going. It's exciting times, and it's exciting. You're the second woman who's been the president of the TCA.
Yeah.
And we were talking about women's issues earlier. I would say, as I said, the hottest topic in chiropractic right now is treating women, prenatal, postnatal, and babies. So, and that's kind of like how your practice is.
Yep.
So, how do you feel the future is for that? And
well, I think if we can actually get more kids and babies in the offices, we're going to have a healthier society overall. Imagine getting care right at birth, and you're just setting up for a healthy spine for life, and that's going to prolong arthritis. It's going to help prevent neck pain, and we're seeing more and more kids come in with issues related to backpacks and iPads and stuff like that. And so we need to fix all of that for them, because as an adult, if you're having neck pain at 7, imagine what you're going to be like at 30 when you're sitting at the desk all day.
Oh, truly. So. And it's such an exciting topic, and it's so fun because, I told my wife when I retire, I'd like to work in a birthing center, because working on pregnant women is so fun, and there's such a great reaction to care, and so they're so grateful. But if you start your healthcare journey from being an infant, you're much more likely to have your health stick with you your whole life.
Oh yeah, I mean, start with mom, right? When she's pregnant, and then have her bring baby in, and then she'll continue on. You're
right, and if you listen to Dave Seaman's talks about inflammation, if you have an inflamed mom who's pregnant with an inflamed baby because of the diet and the whole lifestyle, why would they not react negatively to different things that in their environment and have disease? So if you're able to educate and treat even before they're born, and follow them throughout life and promote health and keep removing those barriers to good health throughout their whole life, which is the premise of chiropractic.
Yeah.
It's self-evident. You cannot deny that that's how true health comes. True health never comes out of a pill bottle. So.
And I also agree with that, because it's we do need the public-facing resources page that we can share, because people like me who didn't see a chiropractor, so I started to work with chiropractors. I never had a negative image of a chiropractor. I just never thought about going because I always associated pain with going to a chiropractor, and I never had that pain. So, but seeing one and knowing that I was born with conditions that could have been helped when I was younger, I have scoliosis, I'll admit that, and nothing was ever done about it. And it affected me in childbirth because I couldn't get an epidural. It just didn't work. And so we didn't find out about how bad that was until I had that very thorough exam. And so I am a member of the public. And without that common knowledge or that education, I would love to share that with other people. And now we can get some resources. So if Parker University would like to share their resources with our public-facing page and that sort of thing, that'd be a great.
We're big on, and Parker Success Academy we're providing free information, and our goal is to keep providing free resources for chiropractors and their patients and their practice, and so that you can use that to educate your patients, educate yourself, and just become a better chiropractor and a better communicator. And I've already done 40 interviews of practices, successful practices, and every one is unique. And how does this person make it work? How does that person make it work? I need to see how your practice runs. What makes it unique? And usually, if you watch that, it's like, that's how I want to practice. That's the communication skill I need to master to get to the next level. So we really are here, as Parker University, we're here to create chiropractors, but to make all chiropractors successful.
Yep.
That's our seminars and everything else we're about. But I know you're battling every day for us in Austin to help us succeed legislatively and to expand the profession.
Yes, absolutely.
We are.
So, thank you so much for joining us today at Parker Success Academy. It's been great to have you here. And you've been listening to Dr. Alayna Pagnani-Gendron and Kaira Tanwar.
Thank you, Dr. Morgan.
From the Texas Chiropractic. Did I get that right?
Yes.
From the Texas Chiropractic Association.
It's been a pleasure. Thank you so much for having us today.
Thanks for watching another episode of Parker Success Academy with Dr. William E. Morgan.